It's frustrating because I just don't get why you would go from point A to point B without thinking about like patient safety.
We spend 6 years studying, and then when you start, you feel trained, you feel ready, and then it is still terrifying.
Yeah. You know, one thing I say to patients a lot, there's a really easy test because, all of our licenses across the country say physician and surgeon, right? So when we become a medical doctor or a DO, it says physician and surgeon. So even if I'm a family practice doctor, technically I'm called a surgeon, which I don't know why it says that. Anyway, even though it says that, it's frustrating because I just don't get why you would go from point A to point B without thinking about like patient safety and care, and I don't know, man. It's like...
And I think for me, so it's like we study for 6 years, and can you replace all of that in a year? I mean, it depends on what your surgical subspecialty was prior to that maybe you could augment in a year and be kind of in a reasonable position.
There is one way, I think, to really tell. You had mentioned earlier, how to find out what they are, ask what their residency training was. The other thing you can ask, and I tell patients this, is ask that surgeon, the cosmetic surgeon, can they perform your breast augmentation in a hospital? Like if you were to say, look, I don't want to do it in your surgery center, in your office, I want to do it at the hospital. Do you have privileges to do that? Now, as plastic surgeons, you and I, we're required to have hospital privileges, right? We have to maintain that to maintain board certification on the American Board of Plastic Surgery. So as a plastic surgeon, a hospital is very strict on what they allow you to do because they have to adhere to what the government tells them is okay, right? And the governing bodies, ABMS and all them. So like for plastic surgery, they'll let me do breast augmentations and plastic surgery, but I can't go do neurosurgery in a hospital. Or cardiothoracic, right? So same thing, a cosmetic surgeon, like you said, if they train 7 years in neurosurgery, even though they're a cosmetic surgeon, they can't go to a hospital and do a breast augmentation because that's not what they trained in. So that's another good test, It's like ask them, can they do it in a hospital? And if they say no, well, then they're not a plastic surgeon.
Yeah. Yeah, so the thing that I was going to say, so it's like for us, we spend 6 years studying, and then when you start, you feel trained, you feel ready, and then it is still terrifying. Right? It's like you're like new. There's not somebody standing behind me who's like my backup. So the amount of guts that someone must have to do a totally different type of surgery after a year, it makes you wonder when they start at that time point, are they getting the type of results they should be getting out of the gate, or are they kind of figuring it out for a while until they get it settled? Because I'm sure there's plenty of people that once you put in the time and you put in the reps and you put in the years, it's like those cosmetic surgeons are getting really nice results, but what was the learning process along the way? And how many patients didn't get the result that they kind of deserved because they came in with 1 year of training instead of 6 years of training?
Totally. I think it's interesting because even some of those boards, the cosmetic boards, for a long time they were trying to almost gaslight the public and say that they had more plastic surgery or cosmetic training than plastic surgeons coming out training.
It still says that on their website.
Oh yeah,
it's still there.
But here's the thing: I will tell you, I know some of these fellowships that they have. I mean, they accredit their own fellowships. These people are going and standing there and watching. They're not actually doing the surgery. So even though they may be a 5-year, 6-year general surgeon and then they go spend 6 months doing a fellowship, they're probably standing there half the time. They're not even doing the surgery, right? And maybe at some point they let them do some, like you said, and so they're figuring that out. And now they're going into the real world with that. And that's really hard for me. And I know it's hard for you and other plastic surgeons because we literally dedicate our 6 to 7 years doing that every day. And I feel like it's so important as well to know the reconstructive principles of plastic surgery that we can apply to the cosmetic or aesthetic principles of plastic surgery. I think it's derived from that. And I think in the fact that you're still doing reconstruction is great because you're still in that realm. But for someone to just completely switch, like you said, a different career path and then do something where they don't have the actual foundation is really scary to me.
Yeah, and I think you land on a good point that these fellowships, you don't know what the quality is. And it's the same thing for residencies, right? There's good residencies and there's not so great residencies. But it's also true that when people come out of a residency that people feel deficient in one thing or another, it's they go and do a fellowship if that's what they want to do. But it's a big question of what that education is and what the quality of that education.
Totally. And let's be honest. I think, like you said, once they get to the point of maybe they've done it for 5-6 years out of their cosmetic fellowship, and they feel comfortable in a certain few procedures, they may start doing different things. Like for the most part, yeah, they'll probably be fine. It's like I talk to people like there's a lot of really good surgeons in Mexico and other countries that are amazing, right? The only concern that I have for that, that's a different time we can talk about that, is more just patient follow-up and issues with that.
Yeah.
But for the cosmetic side here in the United States, like my concern is if something goes wrong and they don't have the background training and how to address those issues, like you're hosed. I know there was a person locally here that didn't have hospital privileges and would always send patients just to the ER. And I know because I was on call. I was taking a call, for this big hospital. I'm a plastic surgeon. They'd call me and say, "Hey, this surgeon so-and-so's patients here has an infected, tummy tuck." And that happened multiple times. And so that surgeon can't go and fix that because they don't have privileges to do tummy tucks in the hospital. So now I'm cleaning and trying to save this patient's life because they're either bleeding to death or infected. And that's just, to me, irresponsible. You're not able to offer the full spectrum of care for that patient, and you don't tell them that. Like, I don't know. Maybe people would still pick them. I don't know.
And you have to be able to deal with things when they go well and when they don't go well. If they don't go well, if you're just like, well, that sucks for them, they have to find somebody else to fix it. I mean, I don't know how that would make you feel. It's like I would feel horrible. That would make me feel bad.
Yeah, totally. Yeah, I totally agree. Well, I think at the end, all the stuff that we're talking about, it just brings to the point that people need to educate themselves, and we're here to help you with that. I think that's part of what we want to do on this podcast, is to help educate people and we're learning too. Like obviously, you and I are continuing to grow. We're 5-6 years into our practice, but I think we've learned enough and seen some things where we can, I think, advise on some of these things, or at least discuss it together. Because you're going to know a lot more things about certain areas that I don't, and vice versa. I think. So I think that's why this will be a good opportunity to talk about that.
Yeah, I feel like this time frame being 5-6 years, it's like. Feels like I'm like hitting my stride. It's like things are like really starting to click, and it's all starting to make like good sense. Because it's like you get good results before, but sometimes you're like, why was this a very nice result? Why did this thing work for this person? And it's just you start to really kind of hammer it all home.
It's really interesting. I love that you said that. It's really interesting to me. I look back at a lot of my cases because, like you and I know, we're constantly reviewing our befores and afters. We're looking at patients. We're following up with our own patients. So now we're looking at I'm looking at thousands of patients over the last 5-6 years. And it's like these small iterations, like small changes, right? I'm like, okay, this time this didn't work as well. And like you said, you see patterns, and you start to slowly adjust things. And then you get to the point where you're like, oh, this is great. But then you're like, I want to try something else to get it even better, right? And then so we're constantly, like I said, these small incremental changes. But I think after about 5-6 years, when you have enough volume consistently, like I said, now you can just have very consistent results, very much more predictable results, I think. And I think even better results. Like I think my results today are better than they were even a year ago. And I feel like if we're not constantly trying to get better, like we're doing a disservice to our patients.
Yeah. I mean, if you're not looking at results and finding ways to improve, it's like you're just stagnant. It's going to end up being an issue long term. I think you see that a lot for kind of some older surgeons. They're like, well, I've been doing it for 20 years this way. It's like, should you be doing it that same way that you've been doing for 20 years? Like technology changes, new things come out, new techniques come out. It's like trying to stay on that cutting edge to get people the best results they can. I mean, it's a really important part of what we do.
Totally. I mean, I know some older surgeons who are just like still at the forefront, right? Like I was just in Vancouver at the aesthetic meeting, and I sat, Dr. Posner, I was with him, and oh my gosh, like he's so experienced, but he is just still constantly looking to innovate, and I love seeing that because I think, whether they're young or old, like some of us are just like fine with being where we're at, and that's fine, but like, is that the best thing for your patients? Maybe, I don't know. But some people also treat this as like, come in, clock in, do my cases, go home, right? Like everybody has a different drive or passion. Again, that's totally fine. But everybody has a different, I think, reason why they do what they do.
Yeah. And you're right in saying it's like it's not necessarily an age thing. It's like there's some people who kind of get used to the status quo and they're fine with that. I mean, I operated with Dr. McCarthy out of NYU before he retired, and
Amazing.
At that time it's like he was older. and
Yeah.
his fellow was gone for the day, and I was just a rotating medical student, like 4th year, and they were like, hey, do you want to go into his case? I was like, sure, I'll go into his case. And his case was like a 6-hour, like, kind of like total facial, like, reconstruction for this tiny, tiny baby that started like nearly alien appearing, and at the end, like a human child, right? It was absolutely transformative, life-changing. When the parents came in, they were crying. I was just like, this is truly impressive. And he was just doing it for decades, right? He was just amazing.